Hello and welcome to the Arise Beautiful podcast. I am your host, Anjanette Kroom. I am a licensed mental health counselor and a self-worth coach. And here at the Arise Beautiful podcast, we talk about 5 different topics. They are self, relationships, service, career/school, and spirituality. And today our topic is going to be service. And so I have a special guest, Dr. Maddox, and I'm going to give her the opportunity to introduce herself.
Okay. As Anjanette said, I am Dr. Debra Maddox. I am the founder of 2 organizations, clinical organizations. One is Multicultural Wellness Center in Worcester, Massachusetts, and the other is Multicultural Wellness West, located in Las Vegas, Nevada. I have a doctorate in clinical psychology, and I am a licensed school psychologist and licensed mental health counselor, marriage and family therapist, rehabilitation, licensed rehabilitation counselor, and a nationally certified rehabilitation counselor.
Whew, I love it. So can you all see why I invited her to be a guest? She has so much to offer. She has a wonderful practice, and as you can see, she has all of these credentials and she uses it to serve her community, and she employs me. I have been working with the Multicultural Wellness Center now for several years, and I've gotten to see the impact that this organization has had on our community. And so let's get into it a little bit. So Dr. Maddox, how did you get into this work?
So it was a progression. I started out as a counselor, but not a licensed counselor, just doing case management. And then I went to work for the Department of Children and Families. And I just saw like that people were not empowered, they were disempowered, they were frustrated, and that there was a legacy of trauma in many of those families. And I felt so horrible being an investigator of sexual abuse, taking children out of homes, and sort of like ripping families apart. And I really wanted to figure out other ways in which I could support individuals. I then went to become a probation officer. Same sense of being stifled, because when you're in a court system, they give people conditions of probation, and if they don't follow those, then their probation gets violated and then they become incarcerated. And it's a very revolving door type situation. It's a cycle. So I was frustrated because at the time when I did that, they really didn't have a lot of supportive services in place. However, my understanding is that now they do. Then I went on to obtain my master's degree in rehabilitation counseling. And after I did that, I started working with people, with individuals, counseling at a multicultural health clinic. But the multiculturalism extended to Latinx people and not really Black folks. So I went on to pursue my doctorate degree in clinical psychology with the goal of opening my own business to serve the Black community. And that's how I got started. Every paper I did was related to Black culture, Black identity. And sometimes it got me in trouble because it was in New Hampshire. But for me, it was eye-opening, and I just like absorbed the information, and I came to understand and learn about, Black psychologists, who came before me, and the wonderful, vast work that they did to support the community.
That Speaking to my heart, speaking to my heart. Because one thing that is really important for me and kind of been driving me is the making mental health care like accessible to
Mhm.
us, to people of
Yes.
color. And
Mhm.
as I went through school, just learning about different things and always being like, how do we filter this so that we're not throwing the whole thing out the window, right? But we're making it
Right.
relevant to the communities that we're going to serve,
Mhm.
learning these things in school and then in practice having it play out so differently.
Mhm. Mhm.
um, and so, I love that, as you got experience and was exposed to so many different things that, you put the lens on and like, how can I problem solve for this for my
Mhm.
community?
Mhm.
And that brings me to why I invited you for service, because
Mhm.
one of the areas of self I believe that's important is service, and how we can use our gifts and our talents to serve our community around us, and
Yes.
that being an extension of who we are. So you
Mhm.
took your interest, you took your experience, you took your education, and you were able to mold it into a beautiful thing that's benefiting our communities and helping other people along the way.
Yes.
Um, and so, in terms of the service that you provide to your communities,
Mhm.
um, how has that impacted the community? How has your agencies served the communities?
Mhm. Well, so it was so interesting because, as I said, my focus was on like the Black community. And so, right after, I think I finished my internship in August, and in September, no, in August, I had my business incorporated. And so we started out doing like, it seemed like private practice. So then a couple years later, we said, okay, we really need to affect change with youth, with families, and just see how we can impact on different levels. So we went to get a clinic license. In Massachusetts, clinics are licensed.
Hmm.
So we went through that whole process, became licensed, pursued with insurance companies, like Medicaid type insurance companies. And so at that time, shortly thereafter, the Child Behavioral Health Initiative came into play, which is more of a holistic way of working within mental health. So it's working with a identified child and just providing wraparound services to the child and the family. So again, the vision was to work with the Black community. However, it just became multicultural because the name of the organization is Multicultural Wellness Center. We started getting referrals from other cultures, and then it just blew up. And we were hiring clinicians who were multilingual. And so we believe in a relational approach, to treating people. If you can't relate to a person, you're not going to affect any type of change. So we became so large, we had over 130 workers, and it was too difficult because our mission is to serve those who have been underserved in the behavioral health field, those people who have lacked access
Mm.
and support. So we hired people with credentials, and those people with credentials didn't always match our mission. And so it just got very complicated. And we had to scale back. We cut back by more than 50%
Mm.
because we wanted to make sure that people benefited from our services. They always benefited from our services, but again, those connections, being able to relate to the clinician wasn't necessarily there. The people that we hired were from a lot of them were from diverse communities. Some of them, English was not their first language. So again, using a relational model for employees as well as consumers, it didn't work in supervision because there were those barriers, those biases with supervisors because they didn't really understand the people they were supervising. So we trimmed it back. And it's a great place. We try and really meet the needs of our providers as well as our clients. So it's working very well right now, except for the pandemic. We're doing a lot of telehealth services. That was kind of difficult getting that people to adapt to that. But I think currently they're able to like adapt,
Mhm.
and it's going well.
Right.
Mhm.
Yeah. Even feedback from the community recently that I've gotten about the agency is that, we are able to service really underserved communities, and not
Mhm.
just saying like, the Black community or the Latino community, but even more specifically being able to break down like, the Haitian
Mhm.
population,
Mhm.
so not just groups, but even subgroups within the
Mhm.
group, and just,
Yes.
um, really meeting the need,
Mhm.
especially, like the immigrant populations as well within the Black
Mhm.
community. So it's a testament to the hard work and the intentionality that you have done with your agency to make sure that it's serving the communities that
Mhm.
it does.
Mhm.
And so what were some of the major challenges that you encountered as you were putting this together?
Well, some of the challenges, it was being taken seriously. I had a lot of connections because, as I indicated, I worked in the community through different systems, like state systems. And so I knew a lot of people. So initially, just getting people to buy into what we were trying to do. And so that was good. One of the largest challenges came from the fact that the cultural matches weren't necessarily there. We had people, again, supervising um, our clinicians who may have been new and they needed to learn, not just that book jargon,
Mm-hmm.
but reality-based work. And because they couldn't relate to that, they didn't understand. And it just created like some disruption.
Mm-hmm.
Um, and then when we started out, we were sort of like a family, everyone was a family. And then I had an open door policy and everyone was like at my door all the time. And so then it affected my ability to get like other work done, but I never turned anyone away. Um, and as I said, we just had to recalibrate ourselves, step back, make necessary changes so that we could continue to grow and serve the community. Because myself and the other leaders in the organization, we work. I don't have an expectation for people that I don't have for myself. So I still see clients, and just putting systems into place and then just um, making the organization, smaller meant having multiple roles.
Mm-hmm.
So one of the problems was not being able to get out into the community. And people I had hired in the past to be out in the community, some of them were like marketing themselves instead of the organization, because they were licensed, planning to go and venture out on their own and not necessarily meeting our needs.
Right.
So it's been challenging in ways, but it's been wonderful to know that we can uplift the community in certain ways.
Okay.
Mhm.
And so the most important like pillar in Arise Beautiful is that self pillar. Um, and so what was the biggest lesson that you learned about yourself as you were on this journey?
Well, I learned that how you're raised impacts how you live in the world. My mom, she still does it to this day. She's not a clinician. Her background is in bookkeeping, but she had this sense of self that she wanted to help others better themselves. So she's always like making it a point that, you have to help others. You got to lift other people up in different ways. So she's always like buying something for this one, buying something for someone for this one, but she's a silent person. She doesn't do it to receive accolades. She just does it because it's in her,
Mm.
and so I realize that I have a lot of her in me. I have a lot of determination. I celebrate Kwanzaa,
Mhm.
and my children were raised, like with Kwanzaa, and those principles are not just for those 7 days. It's 365 days a year. And
Mhm.
so I try to teach that to them. You have to serve others.
Yep.
In order to better yourself, it is serving others, helping to meet the needs of others. And so we have a program, Broader Horizons,
Mhm.
and it's a rites of passage program. And within that program, we teach individuals about, we adapted it. It's based on the principles of Kwanzaa. And it's about identity development, knowing who you are, knowing where you come from, knowing your greatness, because people are put in positions in this world where they don't realize their legacy. They don't realize the beauty of their legacy and that they carry that within them.
Mhm.
Sometimes they may not have the information, but as they evolve and they get educated, they realize, what? I'm not what these people say I am. I'm a
Mhm.
descendant of kings and queens,
Absolutely.
and that spirit lives in me, so that is so important to me. So I realized, because I always was one to read, and I grew up in a period of time when there was grassroots, there were real communities that existed, that people cared for other people
Mm.
and they served others. They, like, my mother was a single parent, and I had a friend,
Mhm.
and her family always went places, like they took them to parks that were a distance away, and I would go with them. So in ways, that family modeled like the two family household for me.
Mhm.
And it was a beautiful thing, it's just that everyone supported each other. And that's not what it's like today, because the world's sort of scary. Um, so that sense of helping others is just a part of who I am, and it comes from my mom.
um yeah, you said a mouthful.
Mhm,
But that is definitely my heart. Like, if there's one message that I preach to the world, is that identity piece, right? Like, knowing who you are, knowing that you have all the tools necessary to like meet the
mhm,
challenges,
mhm,
being proud of who you are. And again, not only were you made with a purpose and with a specific design, right? But
mhm,
it was made to help someone. It was made in connection to others.
mhm,
We are social beings. We were born to be connected with others. So not only do you have a purpose, but your purpose is to ultimately serve, right? Like, you have a message, and there's
yes,
an audience for that message.
mhm,
um and so, again, like I said, I really, I link the pillar of service to self, because service being an extension of yourself. A
mhm,
lot of people sometimes think of service as, going, picking up trash, or the the
mhm,
basic things, serving food to the
mhm,
poor. But also understanding that service can be, you know therapy to the community, building community centers for people to gather and to find healing,
mhm,
providing a space for people to come and talk and share life together. Like, service looks so different. And so that's why I think I picked that as one of the topic areas for Arise Beautiful, is to know that um, you can serve in so many different ways, and to expand the
mhm,
topic of service. So with that,
mhm,
I like to ask all of my guests to come up with a affirmation. I'm
mhm,
one who is really big on affirmations and speaking life. And so a little bit of background is that Arise Beautiful came from a place where one of my favorite passages in the Bible, where kind of God is talking about, come out of the cave, my dove, let me see your face, let me hear your voice. And so when I hear Arise Beautiful, I feel that it is a command to self, like you're calling yourself forward. And so I like to ask all of my guests to come up with an Arise Beautiful affirmation. And so I will open the floor for you to come up with your Arise Beautiful affirmation.
Okay, so I would say, arise beautiful. Let the spirit of your ancestors guide you. Know that you are descendants of kings and queens. Arise beautiful. Do not let images or statements that are projected against you or your culture deter you from realizing who you are. Arise beautiful. Be confident. Set goals, and just know that you are beautiful inside and out, and just call upon your ancestors. That spirit's within you so that you can nurture yourself and help others. Arise beautiful.
Oh, that's so beautiful. That's so beautiful. And that will be so helpful for others. I think specifically for us, the strength that has been passed through the generations, right? Like the knowledge, the wisdom, it's so rich and it's there for and accessible to us if we just ask. So I love that affirmation. Excuse me. I love that affirmation. So I would like to thank you for taking the time to talk to me about your journey and about your service to your community. Continue doing the great work that you are doing. And for all of the listeners, if you like what you heard, definitely like and subscribe, comment, share with your friends. And before we leave, Dr. Maddox, if you want to share with the people where they can find you or have more access to you.
Okay, so for Multicultural Wellness Center in Worcester, Massachusetts, there's two separate websites. It's multiculturalwellness.org, and for Nevada, it's Multicultural Wellness West, and it's info at Multicultural Wellness West. It's mwwest.com. And that is the website, mwwest.com. And you can find information. Both have Facebook pages. The one in Nevada is not as robust as Worcester, but we're working on it. And all my information is on either website. And if you have questions, give me a call. I like to, help others in career, in regards to careers, decisions, and just knowledge. So you can reach out to me and I will definitely respond.
Okay, great. So thank you again for joining us, and be sure to tune in for the next episodes release every Monday. And so I hope to see you soon.